Thank you. Thank you. At the outset, I would like to thank the respected chairs for giving me this opportunity, Banshi sir, and all the respected organizers. And my regards to the stalwarts of the dais. And it's very embarrassing for me to talk in front of Amitabh Bachchan, Chotala Sabha sitting right over here. Both the dynamic authorities are sitting and I have to deliver a talk in front of them. So it's a very humbling experience. And I hope you can help me when I'm struggling. So what I'll do is I'll try to talk totally about something which is recent. We all know what is diabetic foot. We all have been working. We all have been using cast and we are managing diabetic ulcers very nicely. I'll just cover it in brief. Then I'll come to the basic part. What are we planning to do today? I plan to just cover the what's important and we need to understand the physiology. Diabetic foot is not managed unless you really manage the physiology very well. So two things, we need to know how to do the offload technique and we need to understand the gate dynamics. There is no point giving dressings and managing infection if you don't take care of the gate, because it's the gate which is a problem. And understand how the forces work in a normal person and in a diabetic foot person is of paramount importance. Now, why diabetic foot? We should catch diabetic foot when there is no diabetic foot. That's the whole thing. So when a diabetic person walks into your clinic, the bottom line which I follow, which I've been taught by my teachers, is to touch the feet of the patient. Of course, it's very good. You're being very humble when you do that. You're getting the grace of the patient, but you're looking for moisture, you're looking for hair loss, you're looking for blood supply, you're looking for sweat, you're looking for the vascularity. So if you pick up that, you can prevent a diabetic foot from happening. Why is it important? Just look at the issues. Every 30 seconds, somebody is losing his limb across the planet. This is the data from IDF. 85% of complications can be reduced. What is that complication? I'm looking at morbidity and I'm looking at amputation. So those of us who have seen amputation will understand that a simple high sugar ignored, and diabetes is beyond sugar control, ignored because of peripheral vascular disease, can lead to an amputation. Imagine if it happens to your relative, how painful it is. 85% of that can be prevented if you really take it seriously. So we need to understand the basic physiology. See, the arch of the foot is a paramount thing. It's something very unique. Those of us who stay in Bombay, who have traveled in the Kurla Bandra complex, you know how the modern bridges are being made. The Setu bridge, which is very famous, there are arches coming up, and this is copying nature. So nature has given you a fantastic bridge called as the arch of the foot. Most of us don't really take it seriously. If you can monitor the dynamics of the muscles which are important in maintaining the arch, so it's the muscle which is important, not the foot and not the skin. I'll come to that. So compression forces, I'm going little fast, I have 7 minutes. Frictional forces, tensile forces, they all work together to give you the normal shape and the normal kinetics. What happens in a diabetes patient? There's a neuromuscular derangement, there is increased pressure, there is motor impairment, and there is cellular damage because of increased glycation. Damages the heart. And you look at the pressure chart over here in a normal foot, and you look at a diabetic foot, even if there is no morphological problem externally, the pressure changes occur which cause damage. So those of us who are working in the ICU know why you need to change your position. You don't have to do anything hi-fi. You don't have to use any pneumatic pumps and airbags. Nothing you have to do. You have to just tell the nurse to change the patient's position every 4 hourly. Otherwise, you'll land up with bed sores, which is a pain in the neck. So person who's going home after coming out from a nosocomial infection from a ventilator-acquired pneumonia, VAP, is dying because of a bed sore, because nursing care was not given. So all you have to do is manage the pressure counting and you have to do offloading. So if you really do offloading, which can eliminate the pressure points, because your entire 80, 90, 110 and 50 kilos is coming on 1 or 2 points, and naturally they're going to cause damage, and this is happening in a diabetic foot. So obviously you're asking for trouble. So offloading does a critical intervention. It accelerates healing because there is no weight, and it reduces the pressure and it mobilizes the joint and the arch of the foot. Those are the basic mechanisms. And understand one thing in management of diabetic foot, no matter what kind of AI or what modern solutions you use, long back Bolton had said very thing. It is not what you put on the DFU, which is a diabetic foot ulcer, but what you take off the wound, which is most important. So offloading is the secret here. Offloading is the key. And I'm sure Chotala sir would agree with me. The whole art and the whole skill lies in offloading in a proper manner. So I'll just walk you through the offloading techniques. You have the total contact casting, one of the gold standards, like your basal bolus therapy, one of the gold standards in removing the weight and offloading the foot. The total contact cast still today remains the gold standard for managing diabetic neuropathic wounds. There are some issues with it. It's a below knee cast. It works very well for offloading mid and forefoot lesions. It gives you relief around 70 to 100% ulcers within 5 to 8 weeks. There are some problems with it. It has to be changed every week. You need to have a trained personnel putting it. You have to take care of the local wound care for which the patient has to come to you. You face problems when you're walking and sleeping and breathing, and then you could have iatrogenic ulcerations, you could have pressure effects, and very important, you could have muscle wasting and osteopenia. So that is something you need to see. You have other devices like felt padding, yoga mat, removable walkers. You have wonderful shoes, which I'm sure Dr. Chotala Sab had showed us multiple times. There are special shoes which are meant as offloading shoes, which can be used. You can have heel casts which are made suitable to the breadth and the length of the foot of that patient. And you can also have a below knee walking cast. You can also have a removable cast walkers. I'm just walking you through the current things and a very basic offloading technique like crutches, a walker, and a wheelchair. Not glamorous, but highly ignored, but very relevant. So using them in the house, common things occur commonly, uncommon things occur uncommonly. I tell my patients use a walking chair, a wheelchair, or use a simple walker. Believe me, takes care of a lot of problem. You don't have to spend a lot of money doing a lot of exotic things, but we ignore it because it is too common. The Samadhan system of offloading, foam cylinder, some elastocraps, take some bandages, roll it, apply the liquid adhesive, and fix it at the site of the lesion with a crepe bandage, and your work is done. Very simple, very cost effective, relevant for India. Yoga technique, very effective. Problem with offloading of any technique is adherence and cast and complications. It causes something which is very difficult to handle. There is a lot of psychological trauma. There is a lot of morbidity with a cast. There's a lot of work problem which we don't understand, and we need to take that little seriously. So let's come to something modern now. Today, the future is what? You need to have precision medicine. You can have custom molded casts which are designed to improve your gait, which are evidence based. You can have heel wedges, you can have metatarsal pads, you can have focal casts, you can have a powered assistance, you can have a gait retraining. And today, if you combine physiotherapy with a cast where you train the gait of a person, besides just reducing the load, it makes a lot of difference. Today, the word is going for air fast walker, which is very simple. There is a lot of pneumatic pumping of air in selected areas which need to be offloaded. You don't have to do any dynamics. It's the computer and the technology which decides which area should be offloaded through the air and gives a pneumatic padding and not a samadhan or a felt padding or any other padding. So these boots are designed in such a way that they take care of the weight distribution when you walk, when your kinetics are changing, and it takes care of things very nicely. Problem is, it's very costly, difficult to use. You have to be instructed. There is a learning curve, and you cannot drive with this. So that's another problem. But it is something very wonderful. It is sold very nicely. It's very popular in the Western world. You just need to know how to use the pump, and you need to know how to wear it, and you need to know how to unwear it. So put the pipe connector, keep it up, disconnect the pump, calibrate it, and start using it and start walking on it. It's very comfortable. Now, there is also something called as a total wound care system, which I'm not showing here because of time reasons. It can take care of the wound as well as the offloading techniques, can take care of the antiseptics, and the whole system works as an ecosystem to manage a diabetic foot ulcer in a very pragmatic and a very scientific manner. Something which I want to talk about over here, which is very relevant, is a comprehensive care and a precision care. It's very nice to focus on the foot and manage the DFU. But what about the comprehensive approach of managing other issues because of DFU, like muscle wasting and osteoporosis? What about the neuromuscular control? Do you check the muscle strength? Do you check the nerve supply? Do you measure the neuropathy? Do you take care of that? That is also important. So, dynamic orthotics, smart insoles which will calibrate themselves based upon the pressure requirements of the foot, and a 3D printed device which is connected to a computer and an AI system. Since I talk about AI and I'm known as a person who works in AI will take care of the dynamics and give you prediction modeling. Today this is a feature, but we will modify it so that your work requirement can change the foot for tomorrow. That's important. Personalized care, individual plan, and intervention at a time through an AI technique so that the foot can be modified to work the requirements of the patient, making it precision kind of a diabetic foot, and giving you analytics and telling you that this system will make you recover in the next 30 days or 1 month or something. And very important is when you're looking at the modern technique, it takes care of your gait. It looks into your gait kinetics and modifies the gait kinetics depending on your work pattern, your loading pattern, your neuropathy pattern, your muscular pattern, and your gait pattern. I'm sure the current systems are not capable of taking that into account these factors. This is possible through AI, and AI can go ahead and tell you what is the future like and modify the approach of a doctor to that. So, empowering the patient rather than just empowering the doctor is a very important part of this ecosystem. Empowering patient to understand and getting a team funk involved with a lot of input from the podiatrician, orthotist system, and the physical therapist and physiotherapist becomes very important. So, technology plays a major role, putting in a lot of sensors, getting a lot of movements done, calibrating a lot, and giving you the outcome which could be relevant for that patient in the next 1 to 2 months to come. So, implementing offloading strategies by individual through AI technology and calibrating the thing as per the requirement of the patient. And I'll stop on time. So I've just tried to give you a hotspot. It's a big topic, can't cover in 10 minutes. I've just rushed you through the hotspots. But the idea is tomorrow is there to take care of your foot as per your requirement, as per your life. The foot will change as per your needs. You don't have to change as per the foot's needs. So I stop over there with a lot of thanks to the respected chairs and the organizing committee in Banshi sir for giving me this opportunity. Thank you very much.